Breast self-exam. Check the patient's electronic health record to understand the reason for their visit and to note any orders by the provider. Gather educational material. Inspect the breast model for any defects and disinfect it. Place the materials on a clean table and make sure the room is well lit and at a comfortable temperature. Place chairs on opposite sides of the table to allow for face-to-face interaction. Greet the patient. Confirm their identity by using 2 patient identifiers. State your name, your title, and the provider you work with. Perform hand hygiene and sit at the table opposite the patient. Explain the purpose of the educational session and what you'll be covering regarding a breast self-exam. Ask the patient if they have any specific concerns or questions. There are often changes in the breast during the menstrual cycle, so choosing a regular day of the month to examine your breasts provides consistency in the shape, size, and nature of the breast tissue.
My birthday is the 14th.
Great. So on the 14th day of each month, you should perform a self-exam. Instruct the patient to perform the following. After disrobing, look at their breasts in front of a mirror with their hands on their hips. This position contracts the muscles of the chest wall and will make any changes to the breast tissue easier to see. The patient should inspect their breasts for any changes in color, shape, contour, or dimpling in the skin. Also, have them inspect the nipple for the presence of a rash or drainage. To palpate for lumps, lie down and place the arm that is on the same side as the breast being examined behind their head. The patient should palpate each breast using the pads of their 3 middle fingers. Make overlapping dime-sized circular motions with the finger pads to assess each area of the breast for the presence of lumps. Apply light, medium, and then firm pressure to each area. Beginning at the outer edge near the axilla, move across the breast tissue in a top-to-bottom fashion, making sure to palpate all the breast tissue between the axilla and sternum. Also, palpate the area in the axilla. Instruct the patient to repeat this process on their other breast and axilla. Alternately, the patient can palpate their breasts and axillae while showering, allowing the soap and water to facilitate the ease of palpation. Please allow the patient time if they need extra practice on the model. Ask the patient if they have any questions. Provide the patient with brochures covering all the information to conduct the exam at home. Make sure they understand the information. Let the patient know they can call if they have any additional questions. Pap and pelvic exam. Check the patient's electronic health record to understand the reason for their visit and to review any orders by the provider. Perform hand hygiene. Prepare your supplies, checking the expiration dates of the liquid-based preservative containers. Check your equipment, including the light source, to make sure it's functional. Warm the speculum, if applicable. Complete the general information section of the cytology request form. Prepare to add the additional information after interviewing the patient and after the exam. Affix a label to the outside of the liquid-based container that includes the name of the patient, their date of birth, and date of collection, as well as any other identifying information. Greet the patient and verify their identity with 2 identifiers. State your name, your title, and the provider you work with. Explain the procedure and the reason for it using terms the patient can understand. Obtain further information from the patient regarding their reproductive history. Include any treatments, medications, and date of their last menstrual period. Have the client empty their bladder prior to undressing. Ask them if they have any urinary symptoms. If they do, collect a specimen. Instruct the patient to completely undress except for socks and show them where they can place their clothes. Provide a disposable gown. Direct the patient to sit on the table after undressing and place the drape across their lap. Inform them that you'll leave while they are undressing and provide additional privacy by pulling an exam room curtain or closing the door. After confirming the patient is ready, re-enter the exam room. As the provider enters, assist the patient to a supine position by supporting their back or offering your hand for support. Pull out the exam table extension to allow full extension of the body. The provider will now perform the breast exam. You may assist the provider by repositioning the drape sheet throughout the exam. Keep the drape over the patient. Pull out the stirrups and position them at a slight angle away from the table, blocking them in place. Instruct the patient to bend their knees and either use their arms or buttocks to help them move to the bottom of the table. Reassure the patient you won't let them fall. Place the patient's feet on the stirrups. Adjust to make the patient as comfortable as possible. Once the patient is on the table with their feet in the stirrups, reposition the drape so it's in a diamond or diagonal position with the point falling over the patient's genitalia. Attach the light source to the speculum if applicable. Don gloves in preparation for assisting the provider. Lubricate the speculum by placing it in warm water or applying a thin layer of water-soluble lubricant to the outer inferior portion of the blades. Hand the speculum to the provider. Take care not to push on the thumb lever. Help the patient relax by instructing them to take in some deep breaths. Prepare to assist the provider with specimen collection by removing the cap to the liquid-based preservative and placing it face up on the table or Mayo stand. Hold the container firmly within the reach of the provider, who will place the specimen collection device or tool into the solution. Continuing to hold the container with your non-dominant hand, use your dominant hand to vigorously swirl the device around the solution at least 10 times and remove and discard in a biohazard waste container. If brush or broom is the device, you may need to push the device against the wall or floor of the vial to remove all of the cells. Follow the manufacturer's recommendations. Repeat the process for additional specimens. Securely seal the lid on the specimen container. If the biohazard can is near the provider, step on the foot pedal to allow for the provider to dispose of the speculum. Otherwise, designate a container to hold the speculum until the procedure is over and dispose of in the biohazard waste container. It's time for the bimanual exam and rectovaginal exam, if applicable. If using a tube of lubricant, squeeze the tube to allow the lubricant to flow. Avoid touching the tip of the tube to the provider's gloves. You may also squeeze lubricant on a gauze pad and hand to the provider. Have a fecal occult slide available if the provider wants to obtain a stool specimen from the exam to test for blood. Remove your gloves and perform hand hygiene. Following the exam, help the patient to a sitting position. Hand the patient tissues to wipe away any excess lubricant. Inform them what will happen with the specimens, and it will take about 3 weeks to get the results. Invite the patient to take their time to dress. Tell them they can leave when they're ready. Re-enter the room, perform hand hygiene, apply gloves, and finish preparing the specimen for transport. Dispose of any remaining biohazardous materials, dispose of regular waste in the trash can, and disinfect the room. Return the equipment to the storage space and make sure to stock the supplies for the next procedure. Remove your gloves and perform hand hygiene. The provider documents the actual procedure, but document anything you perform in the patient's medical record, including the disposition of the specimens, CLIA-waived lab tests, and any patient information or education you provided to the patient.